So today we are going to be talking about movement and function as we age. Zachary Alfonso is a lead physical therapist for South Florida Baptist Hospital Outpatient Rehabilitation Center in Plant City, Florida. Having local roots with a bachelor's in biology and a doctorate in physical therapy from the University of South Florida, Zach came to BayCare in 2017. Since that time, he has worked in pediatrics, acute care, and outpatient settings with his current concentration in orthopedics and neurology cases. Recent achievements include um, LSVT BIG certification for Parkinson's treatment, as well as steering development of rehab facilities of South Florida Baptist new hospital planning to open in 2024. So welcome, and the floor is yours.
Good morning, everyone. Thanks for joining us today. Hope everyone can hear me well. And it's my opportunity today to get to speak with everyone here regarding movement and function as we age. It's my perspective as a doctorate in physical therapy to be able to give you some insight on our treatment patterns, our expertise, and how we can provide something for our community. So that'll be all bundled into the presentation that we make today. So we'll start with the question, well, what is aging? We asked about movement and function as we age. So, just like a lay person would, I took the opportunity and typed into a Google search, well, aging, or what is aging? And what I found was initially it took me to the World Health Organization's website, and they have a health topic page on aging. The health topic page on aging actually goes into depth to describe aging as an impact of the accumulation of a wide variety of molecular and cellular damage over time. This leads to a gradual decrease in physical and mental capacity and a growing risk of disease and ultimately death. So you see this large depicted word cloud on the image in front of you. And what I did was I took and I copied the entire content of their health topic conversation about aging. And as you see, a bunch of different words came up on the screen as related to the frequency with which they were described in their document. And we see words there such as older people, older age, opportunities, healthy aging, additional years, social environments, public health response. So there's a lot of content there regarding aging. And the question is, in relation to aging and the impact of that cellular and molecular decay over time, are those changes linear and consistent, or are they malleable and varying over time? And it's, as they discuss on their website, they talk about diversity in aging. But most importantly, in relation to that diversity in aging, is that it's not random, but instead as related to variable life factors in conjunction with biological processes that were discussed when I initially defined it. So these variable life factors are the things that we have control over and that we can affect. And the presentation will build us towards mobility and function as related to that aging process. So carrying right ahead, we go ahead and see that we have variable life factors that affect aging. So I've listed 5 factors here, and I've put a nice big square around movement and physical activity. As a physical therapist myself, this is my pride and joy. This is my opportunity to get on a soapbox and tell you about what it means to move and how physical activity can affect aging in a positive capacity. But we'll talk a bit about it first. The National Institutes of Health talked about changes in gait, balance, physical strength can all negatively influence the number of and severity of falls, social participation, and independence. So if those changes in balance, gait, and physical strength all diminish, we can see an increased proportion of falls and decreased participation in lifestyle. But if we see positive improvements in those factors, we can expect that the aging process will be delayed and slowed as we can continue to participate in the quality of life and those other factors that we want to do. The next factor that they spoke about in as a variable life factor that affect aging, according to the National Institutes of Aging, was diet. We often think about dietary choices and behaviors, but they wanted to speak directly to caloric intake and the caloric intake's relationship with obesity and the subsequent comorbidities. So, as we think about obesity, we think about opportunities for comorbidities to present, such as diabetes, hypertension, and socio-emotional consequences associated with diabetes with obesity. So if we can affect our diet in a way to positively trend away from obesity and away from weight gain towards healthier diets, micro and macro nutrients, we can see positive factors affecting aging instead of negative or decline if our diet is unmanaged or inappropriately managed. The next variable life factor they talked about was sleep. Deterioration in sleep quality and quantity in older relative to younger adults. So if we think of older adults being somewhere between the 45 to 55 range and older, it can have cognitive consequences that significantly worsen performance on items such as learning and long-term memory. So sleep is a really important factor for all of us. There's no perfect number on sleep. How much sleep quantity you should have. It may vary by the individual in their life circumstances, but certainly focusing on maintaining good quality sleep on a daily basis can slow the aging process. The next thing they talked about, National Institutes on Aging, is stress management. Believe it or not, healthy cell disruption, because our cells in our body are constantly replicating to keep us moving and growing. Um, that disruption of that healthy cell duplication can be a direct response to chronic stress, which can actually affect at the DNA level with the telomere shortening and producing inappropriate or incorrect cell replication. And they also talk about this concept, and forgive me if I mispronounce it, inflammaging, which is that oxidative stress from activity levels, atherosclerosis, diabetes, hypertension. These stressors can actually further produce inflammatory processes at the cellular level that disrupt that healthy cell replication that we're looking for as we go through life. The final variable factor that we kind of have control over as a human in the aging process is work and social engagement. It's been shown that individuals, especially as we age, if we can maximize our social engagement associated with workplace environments, hobbies, tasks, even chores and household activities, especially when we contribute in a social environment or social setting with other individuals. That can lead to better cognitive function as we age and slowing that aging process, especially at the cognitive level, thinking about our brain and our function. The other thing is a lot of recreation activities provide the opportunity, such as walking in groups, participating in recreational sport and that kind of thing, provide those natural opportunities to create social engagement with other individuals in our community that can lead directly back to that movement and physical activity component that we talked about above. So as we move on from there, you could tell in the last slide that I was very honed in and centric on the movement and physical activity. So we'll look into, well, what's movement? You're going to see a collage of pictures come up, and I'm going to talk a little bit about a couple of the images and the opportunities that it provides for movement. Some things that you may or may not have thought of as you see the images pop up on the screen, think about that movement. So the first one is a very the pinnacle of movement, we would say, right? I'm a big hockey fan, and so my voice is taking a little bit of damage from attending the Lightning games in the last couple of weeks. But we think of pro athletes as that pinnacle or the peak of our mobility level. But that's not the full story. We move on to thinking about something as simple as sitting on a toilet. I often have my patients ask me when I'm testing them to step backwards or to walk backwards. Well, Zach, why are you making me walk backwards? I never walked backwards in my life. And I say to them, sure, surely each day you sit on a toilet at some point or a commode of some type. You think about taking those 2 or 3 steps back, and then the transition down to that low toilet and back up. Maybe you need support, maybe you don't, but all of those factors are related to movement and function. Stairs, do you use the rail? As you see in the image depicted there, you have a couple females that are wearing high heel shoes or high heel footwear. Is that a greater challenge for their balance? The individual who's holding a jacket and making, maybe gesturing to someone else, is he participating in multitasking as he navigates the stairs and maybe not paying attention to his balance? Somebody walking a four-legged friend of ours here in the image, you'd be surprised how many people come across our clinic here in Plant City that, interestingly enough, may have had a fall or a challenge as related to walking a dog outdoors, uneven surfaces. But in addition to that, what you wouldn't think about is how many individuals have shoulder injuries from the movement of holding onto the leash when that dog goes sprinting across the yard towards a squirrel that they saw go up a tree. So that's a movement that maybe you didn't consider in that image. Ergonomics play a big life role for us. We're all sitting at desks at this point, listening to this presentation, or maybe in our cars or on the couch or something like that. But the ergonomics of our position is critical to movement. I have 2 small children at home, which you'll see matches something later on in the presentation. But getting up and down off the ground, playing with children, mimicking their movements, teaching them how to walk, these are all movement related activities. Dance. The small image in the corner depicts a woman who's going from sitting to standing with a walker, has a sort of brace or a stabilizer over her knee, and she's trying to learn how to regain that movement. Gym activity, we often think about this on a daily basis. Jogging, treadmills, ellipticals. These are opportunities for movement. And then similar to up and down from the commode or the toilet, getting in and out of the car. If you have that high truck that requires that you step on a railing to get into it, or the low car that requires that you bend down significantly and squat to get into it, that may be a challenge for your movement as well. So these are all just thoughts that I'd like you to consider as we go through the rest of the presentation. The image you see depicted on the left is a recent sci-fi film produced by M. Night Shyamalan. Some of you may or may not have seen it. It had a story that involved younger people of various ages that went to a beach, and the beach was aging them at such a rapid rate. Fortunately, we don't have to think about that being as rapid for us, but we're thinking about that aging process and what mobility impairments can come along as we age. So naturally, we're inclined to think about injury. Injury is an easy one to think about. It's one that I often interact with here at our clinic. Musculoskeletal injuries can occur from traumatic and non-traumatic circumstances. We think about a car accident that may cause a sprain or a strain, a fall, an ankle sprain, recreational activity participation. I myself participate in a weekly hockey league. So sometimes I'm on the men coming in from various participation in recreation activity. That may involve even just walking outdoors, or just as we age, coming across different injuries where we may have lost our balance, fallen, collided with something, like I said, traumatic and atraumatic circumstances. The next opportunity that you may run into that could produce impairment for you as you age is we see muscular decline. Sarcopenia is a concept that in medicine defined as age-related muscle loss. And I'm sorry to interrupt. If your microphone is on, if you wouldn't mind muting that as well, just to make sure all of our listeners can hear. Thank you so much. It's defined as age-related muscle loss. This can begin as early as the age of 35 years old, and it can progress at a rate of 1 to 2% of your overall muscle loss every year for a typical person. Unfortunately, after the age of 60, this pace intensifies or increases to up to 3% a year. The loss may be mild, moderate, or severe for the individual, but as recognized by Harvard Health, muscles can remain in a normal range of function if activity level is maximized and performed in a specific manner to combat sarcopenia for individuals. The next component that we want to talk about on the slide is decreased flexibility. Studies show declines as we age including simple things such as elevating our arm up overhead or to the side. These movements called abduction or flexion can decrease in the fifth and sixth decade for women as much as 5 to 6 degrees in a 10-year period of time. And when we think back to those functional movements like lifting a jug of milk into our fridge or lifting a child up off the ground, these movement flexibility impairments can become prominent limiting factors for our life and accelerate our aging process. These decreased flexibility components actually only increase with men and women as we age up to 6 and 7 degrees per decade as we reach 60 and 7 in the seventh decade of life. We talk about something, a mobility impairment that's really, really significant for individuals, which is increased risk of fall. This is something that I see often in our practice. In my practice here is that greater than 1 in 3 people age 65 or older falls each year. This is identified by the National Institutes on Aging. Unfortunately, there's a very, very strong correlational relationship with falling and morbidity or your mortality. Deaths from unintentional injuries are the 7th leading cause of death among older adults, and falls account for the largest percentage of those deaths. So, approximately 1 in 4 US residents age 65 or older report falling each year. And fall related emergency department visits are estimated approximately at 3 million visits per year nationally. So we think about mobility impairments. If we fall, what kind of consequence does that have on that aging process? Does it expedite it? Does it magnify it? Something to certainly think about. Disease. This similar to injury, this may be one that we think about very naturally and in part of limiting our mobility as we age. Disease includes things such as strokes, multiple sclerosis, Parkinson's, traumatic brain injuries, spinal cord injuries, obesity, arthritis, balance disorders, cardiopulmonary impairments. The list can go on and on and on. And this is why oftentimes we see different specialists, different physicians, different presenters in our BayCare Presents series to combat some of those disorders. But the consequence of those disorders that can be treated often medically can often produce as well mobility impairments. And how do those impairments relate to an individual's quality of life and their overall movement? The final thing is lifestyle changes. Lifestyle changes can be quite significant for certain people. We think of things such as retirement, right? You're doing a job where you drive to work every day and that's part of your normal routine, and then you retire. Well, how has that changed the number of steps you put in per day? How has that changed your average squatting, your transitions in and out of the cars? Were you working on an uneven surface in a construction environment? Now you don't have those daily balance challenges. We think about things like spousal passing, relocation, and decreased activity responsibilities, such as children moving out of a household, or maybe children moved back into a household. And now you're caring for grandchildren or participating in that parental task that you never were responsible for before. So mobility impairments can actually be stunted or amplified by lifestyle changes that you would experience. Okay, so as a physical therapist, I and the university that I attended, my personal preference on my view of mobility is actually not to focus on those impairments, though. As physical therapists, we've shifted our focus from models of disablement and impairment and shifted strongly towards function. What does a person's function look like? How can we make that function better? Why was that function transitioned to the place where it is as they present in front of us? And how can we correct or remediate that functional movement so that that person can get back to the quality of life that they're looking for? So some functional components that we think about as a therapist is we think about activities of daily living, that ADLI ADLs, activities of daily living and instrumental activities of daily living. Simple things, very simple things, such as opening the door to step outside, sitting down into your car. Those are simple tasks. A more complicated task may involve writing a check, getting up and walking down your driveway, which may have a slope, to the mailbox, putting it in the mailbox and sending it off. That may be a more complicated or multi-component task. And however my patient presents to me, we ask about these functions. What is it like? What is limiting you? How can we make that function better? Quality of transfers, we talked about up and down from the commode, but getting in and out of the bed, rolling in the bed, kneeling down on a knee to pick something up from the ground. These are all quality of transfers. Balance, we may think of it as standing on one foot, which may be something nominal, but we may think of it as something more advanced, such as walking around at the beach on an uneven surface. And this brings us right into gait analysis, where you're looking at the quality of movement every day. The assisted device utilized. Do you need a cane? Do you need a walker? How can we maximize the function with those devices? And then back to those steps and calories and how much mobility you have on a given day. That may be something that we want to consider when we're looking at your function and how it transitions to your quality of life. So, as defined by the American Physical Therapy Association, the movement system is the integration of body systems that generate and maintain movement at all levels of bodily function. So I pride myself, and the APTA, which is the Physical Therapy Association, defines therapists as movement experts that improve quality of life through prescribed exercise, hands-on care, and patient education. So our vision statement really focuses on these things by optimizing movement and that function for people. Exactly what I talked about in the previous slide, where we're moving from a model of looking at impairment to instead focusing on your function. How can we enhance something that may be limited or mobility challenge for you, especially as we consider aging and a process that may be on a decline or a slow decline? How can we reverse that? So I told you I had two small children, a 4-year-old boy and a 2-year-old daughter. And we're often watching cartoon movies. So this is a small video that I found when we were watching Monsters, Inc. the other day. And I'd like to show it to you. This is what some people may consider as a PT and a PT style environment.
Hey, good morning, my travelers. It's now 5 minutes of the hour of 6 a.m. in the big monster city. Temperature's a balmy 65 degrees, which is good news for you reptiles, and it looks like it's going to be a perfect day to maybe, hey, just lie in bed, sleep in, or simply work out that slab that's hanging over the bed. Get up, Sully! I don't believe I ordered a wake-up call, Mikey. Let's start looking. You call yourself a monster? Scary feet, scary feet, scary feet. Oh, the kid's awake. Okay, scary feet, scary feet, scary feet, scary feet, scary feet. Kids asleep. Twins in a bunk bed. What am I doing? Okay, Sully, here we go. You ready? Sully, it's over here. Look over there. Don't let the kid touch it. Don't let it touch it. And I don't know, but it's been said I love scaring kids in bed. Come on, take this back. Take this back. Scary monsters don't have back. 118. Do you have 119? Do I see 120? Oh, I don't believe I'm not even breaking a sweat. Not you. Look, the commercials on.
So, and we all see that it's a fun video to watch. We think about physical therapists and that intensity that Mike was prescribing for Sully was quite intense. And that may match what a physical therapist needs to provide for you to minimize that aging process and maximize your quality of life. But remember that we're shifting back towards the function. I've talked to you about how we analyze and look at every specific level for an individual. And so it's not something to be scared of. PT doesn't look anything like that, but instead looks a lot more functional and quality. See if we can get to the next slide. So this is where I want to bring the next topic to, which isn't that if you're presented with the opportunity to attend PT or you're interested in PT, what would you get when you go for an evaluation? Well, we turn analysis and that observation of function, those tests and measures, into treatment and intervention for you. So we'll go through some of the bullet points. We've talked a lot about function and how, as a physical therapist, we're trained to observe those functional levels. Sometimes, unfortunately, we can't shut it out as we're at church or in the community and we're watching people and analyzing their gait. But here, this is where it's our wheelhouse and our expertise that we're able to provide observation of function and pick up on small things that people are being challenged with in their mobility and how we can improve it. We look at movement patterns. Um, it was mentioned at the beginning of the presentation that I'm an LSVT certified, big certified therapist for Parkinson's treatment. With this and with certain disease states, we often look at different movement patterns and analyze the amplitude, how large someone's movement is. We speak to the quality of the movement, the speed, the stability, the balance, all of those factors, looking at three-dimensional analysis of movement. How are they moving and when they flex, when they extend, when they bring their arms out and they rotate? We have that background, that expertise, that specialty in terms of functional and physical medicine to be able to analyze that movement. We look at gait. Sometimes we do this on treadmills. Sometimes we do it on even ground. I'll take patients outside and we'll work outside in the grass on various slopes, plains, grass, dirt fields, parking lots, curbs. We want to look at how does the gait quality look? What does my analysis tell me about how we can fix the function or amend the function? And how can that slow or decrease the aging process, specifically with gait when it is related to falls? So we have a lot of different opportunities there. With balance assessment, we have a lot of specialized tests looking at someone's fall risk, as well as how their balance grades on a continuum or a scale. For those different things, we use quantitative measures, very specific measures to be able to see how well someone is functioning and how much better we can get them. And then we, of course, have special tests and specific impairment testing where if you came in with, let's say, an ACL reconstruction or a torn ACL where you haven't been exposed to an orthopedic surgeon and you needed assessment of that ligamentous tissue or tendinous tissue, we have special tests designed to identify problems at a molecular and physical level so that we can implement exercises and functional activities that can get you back to the quality of life that you were looking for initially. You see under there also manual therapy and modalities. Think of those soft tissue massages, different interventions with physical with the hands, as well as modalities, TENS, those different opportunities that we can provide to augment the exercise, which is functional in nature. So you think of exercise. Most people think of showing up at that Planet Fitness or at the gym in the top right corner where the woman appears to be performing some kind of CrossFit activity. But it can look like a lot of different things in physical therapy. It can look like resistance training, and this can be calisthenics, free weight training, cable weights, machine training, resistance bands, biodex. And you may say to me, Zach, well, what's different from that and going to Planet Fitness or going to my local YMCA? And I would offer you that as a doctor of physical therapy and as physical therapists, we are specialized in knowing from the cellular molecular level all the way to the functional level what exercise specifically an individual needs to maximize their quality of life and the function that they're looking to see, as well as being able to modify that and advance a patient in the appropriate capacity. So this is where you go to like functional movement, where you see the individual in the top left corner of the screen doing large amplitude movements with their arms. This is a type of balance training and mobility training that can help someone attain balance and reduce fall risk. You see aquatic therapy here at South Florida Baptist Rehab. We have aquatic therapy for both pediatrics and adults. This provides an opportunity where buoyancy can reduce the weight bearing on an impairment or a site of injury, allowing for a more rapid or quick opportunity for recovery. Gait training, you see the individual in the parallel bars, but this involves body weight support systems. Treadmill training in systems such as an Alter G, where you would offload the weight and allow to teach someone how to walk sooner, better, and at a greater quality. And then you see it supported by modalities, different bands, various implementation of massage techniques, stretching techniques that the therapist can actually physically utilize their hands to make an individual better. I often tell my patients, I'm pleased to have the myriad of equipment that we have here, which is state of the art and excellent across our BayCare system. but I can often do my job outside in the grass with my hands and my exercise expertise at the same quality and achieve the same functional outcomes. So it's really that expert that you're coming to see as a physical therapist that can give you those opportunities. So to bring it all the way full circle, I wanted to provide an opportunity to look at some maintenance programs and how it would span the lifetime. Daily exercise recommendations from the CDC say that adults age 65 or older need at least 150 minutes per week of exercise. 30 minutes of moderate exercise, such as brisk walking, and 75 minutes of intense or vigorous exercise, such as hiking, jogging, or running. At least 2 days a week, they need to strengthen their muscles, and they should focus on activities to improve their balance, such as standing on one foot. So, to give an opportunity to progress through some of these exercises, I've outlined 3 hip candidates that may come in just as examples of patients that may come in to see us here. I've designed a 43-year-old female skier who has greater trochanteric bursitis. It's a type of inflammation of the hip. And some exercises as she matured or graduated from physical therapy may include stretching of the hip, clamshells working against resisted bands where you're opening the hips and closing the hips. The picture that you see depicted there, and if you'd like to try it, this is a great opportunity to stand up and try it. You see an individual with a really wide base of support, really focusing on those gluteals or the hip muscles, the buttocks muscles behind. They're in a deep squat where they can get the activation of those muscles and then elevate up out of that squat. Something that you would see where the individual was maturing or graduating to a gym-like setting. So that's our 43-year-old. Now let's fast forward to a 65-year-old retired mechanic example. He recently had a total hip replacement, and he may be transitioning at the end of his care to doing something like moving his hips in those 3 planes of motion, in, out, forward, walking up and down stairs, both forwards, backwards, and to each side, if that was something that was challenging for him. Doing something as depicted in the image where you do a split stance, sit to stand. I offer for all of you to try something like this. Place one foot ahead of the other foot, and you should anticipate that the foot that's towards the rear, the quadricep or the leg muscle, the thigh muscle, will be required to maximize its force output to lift you up. It allows you to focus on one side versus the other. And then stuff like brisk walking daily would be a great idea for him. Then you have a 91-year-old male living in an assisted living facility. He had a hip fracture. These exercises may be truncated or minimized to his functional level, which may include, like the picture before and below, standing up from a chair supported with your hands on the chair. Outdoor walking with an assisted device such as that walker. But the most important thing is that your therapist is specialized in exacting these exercises to your condition and your functional level in an effort to maximize it across the board. So you may say to me, Zach, all of this sounds great. I think I've got some mobility, maybe challenges, and I have some functional things I'd like to get back to. How can I get in touch with your services? So I put on here a link to our website at BayCare. There's a map depicting all of our clinics. We have a myriad of clinics spanning from all the way from Polk County to Pinellas County. And this provides a lot of opportunities for our patients. Now, they may ask me, well, Zach, do I need a prescription? Oftentimes with insurance coverages, it's best to receive a prescription either from a primary care provider or any kind of specialist to come down. And I provided our scheduling line there. The 813-443-8028 number is a number that you could even reach out to and say, hey, what do I need to come for physical therapy? This is the type of insurances I have. How can I get to your facility? I think physical therapy might be a good look for me or a good opportunity for me. So feel free to take a picture of that image and reach out to us if there's anything we can do for you. In addition to that, I provided a link at the second slide that talk about some of our specialized services that we provide in addition to physical therapy. We do lymphedema treatment, functional movement screenings. Sometimes that's for young athletes. We do serial casting. We do speech, voice, swallow therapy. That's provided by a speech therapist. We have occupational therapy that works towards functional movements and quality of life activities. We do vestibular rehab if you have vertigo and those kind of factors. So there's a wide variety of functional improvements that we can provide for you as physical therapists. And this provides you an opportunity to see what sites we have those specific services at, as well as opportunities that you may get by coming to rehab. And I'll leave you with a quote that says, consciousness is only possible through change, and change is only possible through movement. I really hope that you had a good opportunity here to see that movement is one of the driving factors in aging for us. And as a physical therapist, I'm proud to daily provide opportunities for patients and the people that I meet to maximize their movement and maximize their function. Hopefully, you're leaving with an idea of how we could help you in that capacity. And if you have any questions or concerns or any interest in physical therapy, I would offer you to follow those links and see if BayCare can be an opportunity for you in your community to maximize those things you're looking to achieve. And without anything else, that's my reference list there. And I think we'll open up for questions if we have anything specific.